everyone, this is Katie. I'm here today to talk about Temporomandibular Joint Disorder. I had a friend ask about it, so I was going to do a video over it. So let's talk a little bit about this. I'm going to share my experience, but I am going to share a little bit of information on it. So this disorder, of course, has to do with the jaw joint. And for those who don't know, the jaw joint is basically comprised of the mandible, which is the jaw bone, and the temporal bone in the skull here, and the joint connects the two. And the joint, it isn't like a typical hinge joint, but it's also not like a rotary joint. It's kind of like a combination of the two, because we can move our jaw up and down and we can move it side to side as well, but it is very complex. It's called Temporomandibular Jaw Disorder, and a lot of people refer to it as TMJ, but it's actually called TMD. TMD is the technical term for the disorder. TMJ refers to the jaw joint. So the jaw joint, when we start having problems with this, is very common among people, not just musicians, but because we use our jaw a lot to talk, to chew, to speak, to swallow, anything to do with the jaw movement throughout our life. So we do have a lot of wear and tear on our jaw joint. Now, the jaw joint is very complex, and when people start having problems with it, it's hard to diagnose TMD. It's very easy to come across the symptoms and to validate the symptoms. It's very hard to find the source of what is causing your TMD, because it can be multiple things. Most commonly, the jaw joint does suffer a lot from overuse, whether it's through certain foods we eat, a lot of chewing, or just because of our individual skeletal structure. We might not be built with that type of structure where our joint is that efficient over a long period of time. It can be due to arthritis and inflammation or some type of injury that occurs. And then with musicians, of course, it's very easy to see how many of us suffer from TMD because of the use of our jaw, especially those who are brass players, wind players, singers. And it's interesting because I feel like singers, they learn a lot more about their anatomy and about their jaw movement and the efficiency and how to take better care of their body and their anatomy, know more about their anatomy than brass or wind players do. When we're brass players, we tend to think a lot about our embouchure, but we never think about our jaw joint or about our skeletal structure, our neck, or our posture, not just our posture, but we never think about the details of how these things work and how we can take better care of ourselves and be preventative and start doing preventative care in the long run versus just taking care of it when it comes up. Some of the signs and symptoms, let's go ahead and talk about that. So TMD is usually, you'll see a lot of referred pain. So what's interesting about it is that some people do have pain. A lot of people do have pain, but not everybody does. And the symptoms vary. They're very different. So with referred pain, you can have headaches, you can have neck pain, you can have shoulder aches, you can have tooth aches. This can also lead, if it's really bad, it can lead to like tendinitis, inner ear problems, and with the inner ear problems, because there's inflammation happening, this can cause balance issues or dizziness or vertigo. And it tends to affect more women than men, which is really interesting. I don't know why. Other signs and symptoms, of course, one of the primary ones is going to be, for a lot of people, is going to be malocclusion. So malocclusion, so first talking about occlusion. Occlusion is the way the mandible or the lower jaw and the upper jaw, which is called the maxilla, come together. And when there's malocclusion, this just basically means that your teeth aren't aligning, or your jaw isn't closing or aligning or moving in an efficient way or in a comfortable way or position that's needed. A lot of dentists will point out that there's an imbalance in the fulcrum of your occlusion. So I don't know how they measure the fulcrum. So fulcrum means balancing point. I don't know how they measure it. It's something to do with the measurement in the back teeth or something like that. I'm not sure. But they usually bring out something to deal with the fulcrum, and they try to address this by realigning your jaw through various means. But yeah, some of the symptoms with that, when your jaw is out of alignment, you'll notice deviation when you open your mouth. It'll go to a certain side. Your teeth don't fit a certain way. Also with TMD, you'll have pain while chewing, pain in the face or jaw, you'll have clicking or grating or popping sounds in the jaw when you open or close. You can have lockjaw happening, and then there can be a little bit of stiffness as well. So it just varies on the different symptoms. For some, it's going to be like you're experiencing inflammation that's happening and you don't realize it. For others, it's that the jaw is misaligned and you're like, it's opening and deviating and going to a different side, or you find that you're biting your cheek, or you find that you're like chewing things differently, or it just feels off in some way. But you feel all these other pains, like your neck is sore all the time, or that kind of thing. But what's interesting also is that you should know that in the jaw joint, it has a disc. And this disc, which is called the meniscus, it's made of fibrocartilage. And fibrocartilage is different than the cartilage you would find like in your knee, because I think in your other joints, the cartilage is called like hyaline cartilage. What's interesting about this is the meniscus cartilage in your jaw joint contains both types of collagen, so collagen type 1 and 2. Collagen, you cannot regenerate collagen. So what I'm pointing at here is that the disc in your joint, sometimes what happens with TMD is that they'll find that the disc has worn down over time, either on one side or both sides, because of pressure or because there's some type of wear and tear or something's happening that's causing the disc to be under pressure. The disc wears down over time, and if it wears down over time too much, this can cause the bones to actually start touching each other, and this can lead to like arthritis or even worse, like surgery that you have to get. But the disc is irreplaceable because cartilage does not regenerate. It does not regenerate because it requires stem cells in order to do that. And also the cartilage does not receive a lot of blood flow. That's why some people try acupuncture to help relieve their TMD, because they try to get more blood flow going to this area to help support the joint. But the disc itself cannot be replaced. So that's why they try to adjust it as much as they can right away. The disc can also get displaced, and when the disc gets displaced, it causes the jaw to deviate or go to be off in a certain way. But there's all kinds of factors that play into what possibly causes TMD. It's not just always overuse. There's also psychological factors as well. And I'm not talking about just stress. They have done research studies that show that, you know, certain jaw problems that people have are tied very heavily into people who have trauma. So for example, like bruxism. And let's go ahead and talk about some of the other things that are kind of related to TMD that are similar that you might not be aware of. So bruxism is when you're grinding or clenching your teeth. So people who do this very heavily at nighttime, or they tend to do this while they're driving or just throughout the day, and this is like something that's just either automatic or they're doing it and they don't even realize it. Also, what's confusing about that is that, you know, people with TMD, some of them do grind their teeth or clench their teeth. Bruxism is when it's really chronic, when this grinding and clenching is really chronic. And then there's arthritis, which is where you feel like sharp shooting pains. There's more of a lockjaw going on and more stiffness in your jaw in the morning. Trigeminal neuralgia. Now this is a little different. So trigeminal neuralgia is nerve damage, and nerve damage is really painful. And the key thing about trigeminal neuralgia that you need to know is that it's all about sensations sending a signal to the brain that causes this excruciating pain. So it's any type of sensation that sets it off. So this could be chewing, speaking, brushing your teeth, feeling wind against your face that flares this nerve up. So it's what it feels like. And I had a run-in with this because I overdid it on acupuncture once, and this caused my nerve to be too sensitive. And it feels like when it flares up, it's like radiating from your jaw joint. It feels like it's radiating from your jaw joint and just flaring out across the face, just flaring across the face. But it's very painful in the sense that it's sensitive. It's sensitive, like your skin is sensitive, your teeth are sensitive, everything's sensitive. It's like it's just like the nerve the nerve touches every little area of your face. So it's like any type of thing you do, it will cause you pain to this nerve, causes excruciating pain to this nerve. So it's more of a pain that's like not so centrally located right here in the jaw joint, but it's just something that kind of you sense it's spreading throughout your face. Like when it starts flaring up, it's spreading throughout your face, and it just feels like you're on fire. Like it feels like, I remember it felt like I just wanted to like completely dunk my head in an ice bucket and just numb the pain out because it hurt so bad. But I'll talk about my experience with onset TMD a little bit here, but I want to kind of continue talking about this first. So for those who don't know, any of the nerves that control our facial movement or our muscles, they run through the jaw joint. And it's really interesting because when you look at the pictures, it seems so delicate. It seems like it's like this little bundle of nerves, and then they just kind of pass through the jaw joint, and then they run out throughout the face like little tree branches. So anytime you're having problems around the jaw joint, or even people who are having nerve damage or nerve problems, sometimes it ties into the jaw movement or jaw joint. So we don't often think about how much our jaw joint and our jaw movement plays a role in our injuries and in our health and in our playing. If you're having any of these symptoms and you're not sure what's causing it or what's going on, you definitely want to go and see a dentist. For me, I went to a neurodentistry. A neurodentistry is really great because what they do is their dentists also specialize in neurology surrounding dental care, surrounding the facial muscles and structure and nerves. But you definitely want to make sure that they do a joint film, which I'm not sure what the technical term is, but the abbreviation is CBCT. And then you want to get the radiologist's report to rule out the degenerative joint disease. And then, yeah, they'll go ahead and usually look at the occlusion and how that is in your jaw, and they'll usually feel your jaw joint movement and look at it and see if it's deviating in any way. They'll usually ask you all kinds of things about your health, about your eating habits. Like I said, it takes a long time to treat it and to figure out what exactly is going on when you have really chronic pain happening in your jaw joint. Let's go ahead and talk about like some of the treatments that they do use, and they all seem very practical. There's not really a remedy that they found that is 100% efficient in helping people completely overcome TMD. So usually they'll use like medications, bite guards, physical therapy. They'll talk to you about relaxation techniques, stress management, ice packing, heat packing. Sometimes people do biofeedback therapy, stretches, physical therapy, acupuncture, TENS unit work, which is what I did. Sometimes people do splints. If you do get a mouth guard or you use a mouth guard in general, I really want to emphasize using a custom-made mouth guard, like through your dentistry or through a professional service. Anytime you're messing with the opening of your mouth, it can be a little bit dangerous. You want to make sure that you're not making your jaw alignment even worse, or that you're not damaging or causing harm to your jaw joint. They also use non-steroidal anti-inflammatories like aspirin. They'll use nerve pain medication, muscle relaxants, or sedatives. Muscle relaxants, sometimes they'll use diazepam, and so that's very common. And then at the worst case, people will do surgery on their jaw joint. But as musicians, of course, we're like, no way, Jose. For some musicians, they try Botox, and just people in general who have TMD, they'll try Botox. Now, with Botox, the FDA doesn't approve Botox as a form of treatment for TMD. So you usually have to pay for it all out of pocket, and this can get a little expensive. And I have never received Botox, so I don't know how all this works. But if any of you have, please leave in the comments like what your treatment was, especially if it's related to TMD, and if it was effective, and how much they injected, and how much it usually costs for you. And then if you had any way of covering it besides just out of pocket, then let us know. I'd love to know more about it as well. So I want to talk a little bit about my experience with TMD, my very first attempt at retraining from focal dystonia. At the time, I didn't have anyone really telling me like how to look at it in a neurological way, because it is a neurological disorder, and it's very hard to navigate a neurological disorder and understand how the brain works and how you need to reroute your playing in a certain way. So what was happening was, when I first started rehabilitating, I was using my normal embouchure that I've used for the past 20 years of my playing. I was just trying to use the normal setup. But the interesting thing with focal dystonia is that the brain pathway that's being sent is broken, and because the brain pathway that's being sent, that means that there's an antagonist and antagonist muscle that are fighting together. So when the signal sent, these two muscles are receiving mixed signals, they're fighting, and that causes the spasms or the involuntary contractions that you see with embouchure dystonia. And then when you're dealing with that and you're trying to use that normal embouchure formation, it's fighting those symptoms as much as they can, and this can become very taxing. And the other thing is that this normal brain pathway that you use for 20 years is broken. So the more you use it, the more wear and tear it's going to have, the more less efficient it is actually, because it's very dysfunctional. Even though it may look good, even though you might think that it looks good, it's not good at all. So yeah, I was like, doing the typical embouchure formation, and because I had the spasms going on, I was trying to keep my formation together. I was trying to keep my normal embouchure in place. And actually, I didn't start to feel this pain in my jaw joint on my right side until maybe, I want to say it was like a year into rehabilitation. And it was interesting because I felt like my playing was all right. I was kind of keeping the spasms in check. They weren't getting worse, but they weren't getting better. I was just kind of plowing through them. I was just kind of forcing my embouchure to hold in place while the spasms were happening, rather than working with the spasms or working around them and creating a new brain pathway. Because if I let things go and I tried to figure it out, it was too much. I was just trying to use our normal brass pedagogy and what I've been taught the past 20 years of what embouchure form and function is, which was wrong, which was totally wrong. And so because I did that, I started experiencing this pain in my jaw because I wasn't listening to my body. And but what's interesting is that I wouldn't feel the jaw pain when I was practicing. I would feel it maybe like 30 minutes, maybe even an hour after I was done practicing. So I would go home, I would be cooking dinner, or I would be driving in the car, and all of a sudden I would start to have this intense pain in my jaw joint, and it would just get really bad. I would just be rubbing, and then I would feel this like clicking going on, and then I felt like my muscles were just really bulky, like there's really tight there. And I started to have pain in my neck, and my jaw started after 3 months of this, my jaw started to act weird. So it's like I would be sleeping in the middle of the night and my jaw actually accidentally bite the side of my cheek, or I'd be chewing food at dinner and I accidentally bite my cheek on this side, or when I chewed, I felt like the bones back here in my jaw were like off. Like it's like they weren't sinking like this. Instead, they were like going like this, almost like they were like it was falling off. It's like I felt almost like, I don't know if it was like the disc inside my jaw joint that was off, but I could feel it. And so I was like, there's something going on here and I don't like it. I feel like I'm experiencing the symptoms of TMD. So I ended up going to a neurodentistry when I was in Boulder, and this dentist basically looked at my occlusion and did all these tests and everything. And what's interesting is, like, some of the couple interesting things that came out of that test was, first of all, he noticed that my strength of bite was very, 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 very weak. And then the second thing was that they said that my jaw joint was very compressed. He said it's almost like your muscles are pulling your jaw all the way to this side, and it's causing your jaw joint to compress on this side. And he said, and I think it's because of your practicing, because of your horn playing. He said it's because it only flares up after I play. It only flares up after I play. And he said, so there's obviously some type of signal that's being sent, you know, to your body is calling for an action to take care of this after you're done playing. It's like, hey, I need help. And all of a sudden this side flares up and your jaw joint flares up, and you're experiencing this inflammation, and you're experiencing this tension here. And he said, and it could be like the dystonia flaring up, but also I think this dystonia is affecting your jaw joint. It's causing this tension up here, and it's causing everything to misalign. I also started talking to my neurologist about it, and I was like, listen, I don't, you know, like, it makes sense that, you know, the dystonia would be causing my TMD in some way, but I don't know how. And I think maybe it's the way I'm practicing. And so I started looking at changing the way I practice, but also at the same time, my neurologist was like, yes, of course it's going to affect your jaw joint because your dystonia affects your playing from side to side. He said anyone can see that one side of your face, the muscle usage, even when I'm talking here, I always point this out in videos, even when I'm talking here, there's this side is much more defined. So my right side, you can see, does all the work, the muscle movement and work, even when I'm talking, and the left side is more flaccid and loose, and you don't really see my zygomatic muscle kicking in there. So I'll show you. I'll try to do one movement here and one movement here. I'm going a little off track, but I'm going to show you here. So I'm going to try and pull this muscle this way, and then I'm going to do this side. So let's start with this side. Normal movement. Right? Easy. Now watch this side. You see the spasms? Now this side. It's so, you see how it's difficult. It's like I'm 85% recovered now. So it's like you can imagine back then how much lack of function I had on this side of my face. When I realized this, I was like, oh, I get it now. So when I'm practicing, I'm trying to retrain from my dystonia, not only are these muscles on this side like overworking themselves because this side is not kicking in, they're overworking themselves and it's causing a lot of pain to this area, but also I need to stop trying to use the normal setup that I'm using because it's not working, and I need to find a way around this. So I actually ended up going to see an acupuncturist. I was doing it for 30 to 45 minutes once a week. Ended up being too much for me because 7 months in of acupuncture, I was realizing that it was too much because my facial muscles had gotten so loose, which it felt great. It's like the first time in my life I can actually remember that feeling of what it felt like, you know, before I ever did anything with my face, like played the horn. I don't know how to describe that. It's like, you know, childhood. It's like, oh, I haven't felt the sensation since I was a kid, like, you know, where my muscles were just so relaxed and loose, like I don't even use them for anything. Like that kind of feeling. But I overdid it, and when I overdid it, it actually caused my, like I said, my trigeminal nerve in my face to be too sensitive, and this caused the trigeminal nerve pain to flare up. And so all of a sudden I was experiencing this excruciating nerve pain in my face, and I couldn't practice anymore. So I put my horn down. I put my horn down completely because I was like, I can't with this jaw pain and now this nerve pain. I'm just taking a break because I need to take care of this. I need to figure things out. But with the trigeminal nerve pain, it was so excruciating because what happened was my facial muscles and my nerves were so loose and so exposed that anything I did would cause pain, but not pain in the sense of like jaw joint pain, because this type of pain I'm talking about, it's almost like a pain that comes from weakness. It's almost like you're too weak to lift something up, and because you're so weak, it hurts to do that action. So I stopped doing acupuncture right away. I just so happened to be leaving that acupuncturist, and she had to go on maternity leave, and my last session I had her stand-in come in, and she was talking to me, and her stand-in acupuncturist was telling me, she said, well, I also do myofascial release therapy, and I actually work with people who have had facial trauma or facial damage done, whether it's Bell's palsy or, you know, they've been in a car accident or anything. She's like, and I've helped people, she's like, I've helped many people recover through myofascial release. And so I'm not going to go into too much detail about that here, but that's what actually eventually ended up helping me overcome the TMD symptoms that I was having. It completely overcame them. I did 3 videos on myofascial release on my Living with Embouchure Dystonia YouTube channel. Basically what myofascial release therapy does, they go inside your mouth, and again, you want to work with somebody who specializes in this before trying this on yourself, but they go inside your mouth with their thumb and they find the key points of tissue. They break up tissue in your joints and in your muscles. Anywhere in your body you have a joint, like for example the wrist, let's say you're doing a lot of wrist movement and the tissue builds up in your wrist to try to protect your wrist from damage. But because you are moving your wrist so much over time, that tissue starts to actually cause problems and dig into the nerve in your wrist and cause carpal tunnel. That's why you see people have carpal tunnel. And she says the same thing with the jaw joint, with any joint. She's like, there's tissue that can build up around your jaw joint that support your jaw joint. It's our job to go in there and break it up and loosen it up. So by finding these trigger points. Now, in a lot of cases with pain, especially TMD, health providers will try to find a way to interfere with that signal that's being sent from the brain of, I need to help you, because sometimes it tries to overly help you in a way that it's damaging you. So for example, with the TMD, not only did the myofascial release therapy help me, and again, you can check out the videos in the description box below, not only did the myofascial release therapy help me break up the tissue, but also TENS unit work, which I did with my neurodentistry. So my neurodentistry, like I said, when I went to him, and he was telling me that there's compression in my jaw joint. He originally wanted me to get a custom splint, but at the time I was in graduate school and I couldn't afford it because he said it was going to cost around like $7,000 or something. I don't remember, but anything in that range I can't afford. So I was like, I can't afford it. But he started doing TENS unit work on me, and it was helping, but I couldn't afford the sessions. I actually had a friend that has focal dystonia, and she said, you know, I have a TENS unit and you can borrow it. And so I borrowed it from her for a while and worked with it, and then eventually I saved up enough money and bought my own TENS unit to work with at home. Now, am I suggesting that you not work with a specialist? No, I'm just telling you what I did and what worked for me, because I couldn't afford everything. But I used the TENS unit at home, and it is a really intense thing to use. Not a lot of people can handle adjusting to the electric currents, and it takes time and it takes a lot of getting used to using it. What the TENS unit does is it stops that signal from the brain that's saying, I need to inflame the body here. I need to cause swelling here. It stops that pain signal from being sent, and it allows the joint to heal on its own without the inflammation happening or all the bells and whistles, if that makes sense. So the myofascial release therapy and the TENS unit worked for me. But also what's really interesting is that when I was doing the myofascial release therapy, I remember there was a very specific day, and it was just like one session after several sessions. There's one session that she was doing where she was like loosening, because she not only loosened up the tissue in my jaw, but she also loosened up the tissue around my neck and around the base of my neck and the back of my neck and my upper back here. She was like doing something with my jaw here, and when she was doing that, she released some tissue there, and I felt my jaw drop. It like dropped because it was really misaligned at the time, and it just like dropped, and all of a sudden my teeth closed like the normal way they should. They were like back into alignment, and I remember trying to like pinch myself every night I went to sleep, because after every night I expected, you know, to have this pain or to keep, I was like, it's gonna come back, it's gonna come back, it's gonna come back. But I kept doing the TENS unit work even after my myofascial therapy ended. I kept doing the TENS unit, and the pain never came back. The TMD never came back. My jaw never deviated or went back into that position again, or got, you know, out of alignment again. So I was like, I really need to pay more attention to my body and also keep doing this type of preventative work to make sure that my jaw doesn't become misaligned again, and also most importantly, adjusting the way I was rehabilitating on my horn, and thinking of focal dystonia more from a neurological standpoint, and understanding it from a neurological standpoint, and also understanding the anatomy of my body and how the nerves work, the muscles work, how the jaw joint works, just everything. Everything is so important. So it's like I had to do a complete, you know, 180 as far as just rethinking how I was taking care of myself. And I feel like anytime you face an injury, whether it's TMD or focal dystonia or any type of music injury, that could really get in the way of your playing in a catastrophic way. I think it's very important to think about really changing your lifestyle completely. And I mean that with my whole heart, like completely change your lifestyle, like changing the way you eat, the nutrients you take in, any type of nutrients you take in, any type of nutrient supplements or protein supplements that you take in into your body, thinking about the way you move your muscle throughout the day and the way you move throughout the day, and thinking about what you can do to stretch these areas of your body that have tension that we usually just kind of ignore throughout life until they peak up with some type of severe damage later on. Also, I started taking collagen, which really helped me. So I take collagen. It's important to know that the cartilage of the jaw joint, after it gets worn down and everything, it can't regenerate. There's no way it regenerates. It has to have stem cells in order to do that. But what's interesting here is that the cartilage does have collagen type 1 and 2. Now, collagen serves as kind of like a buffer. It gives the disc its strength. So it's like a collagen peptide protein. So it provides the cartilage strength, and it creates a framework that houses the other components of the cartilage. Like the more you can buffer that cartilage or support it in any way you can, you may not be able to regenerate it, but any way you can support it and help it from you know, getting further damage, you should do that. And one of the ways you can do that is collagen. It's shown in research to be very beneficial overall in general with tissues and joints, just within your whole body. So this is like one of those things where it's like, you know, if people are like talking about the benefits of omega-3s, or talking about the benefits of eating kale, or you know, like those superfoods like avocados, this is one of those things where it's like collagen. Like, take it. Take it, take it, take it, take it, take it. I swear on my life. You just want to research it if you decide on doing something like this. Other types of supplements that you can take that are found in the jaw joint, and I can never say these: glucosamine sulfate and chondroitin sulfate, and of course the omega-3 fatty acids. I think anytime you're experiencing problems with your jaw or facial muscles, I think the first thing you should do is make sure that you're taking really good oral care, like upping your oral care if you aren't already. Like, I mean, investing in like a water flosser, really making sure that you're not getting any infections in your mouth. But the main thing that I'm getting to here that has helped me the most is going to be the oil pulling. So originally I started oil pulling because I wanted to take better oral care. You can research this if you want, but with oil pulling, basically you're using an oil like coconut oil to swish around in your mouth, and it cleans it out, and then you spit the oil out, and then you just brush your teeth like normal. I actually ended up using castor oil. I know it's a huge jug, but I cannot say enough about castor oil. I'm gonna be like one of those old ladies that are like, back in my day when I was a brass player, I used castor oil for everything. It is an anti-inflammatory, and what I do is I take 2 tablespoons of it, I swish it around in my mouth. You don't swallow it, you swish it around in your mouth, and I swish it around for 20 to 30 minutes, it depends. It really helps with any type of soreness, any type of inflammation, any type of tension in your face. If you're a person that has a lot of tension in your face after you practice, like if you're trying to overcome focal dystonia, you have a lot of tension in your face, it helps immediately relieve that tension. If you're having any type of pain, it helps with preventing the swelling. If you're having any type of soreness, it helps relieve the soreness. It's just like an all-around really great thing to use. It's interesting, I've read all these articles on people who have TMD and they'll use castor oil and they'll praise it so much, but what they'll do is they'll like soak, you know, little towels in it and they'll like put it against the sides of their face, but it's like, that's so messy. It's like, why not just put it in your mouth? And you know, that's much more effective. Castor oil is kind of bitter, but it's not like that bitter, so it's like not that bad. I don't know if coconut oil will be as effective, but it will probably taste a lot better. The other things too that I use, an ice roller. And what I love about this ice roller is that of course you can roll it across the surface of your face, like at different speeds. You're not just like holding it in one spot, you know, for like a couple minutes. This, and then with the heat pack, I don't have that here, but the heat pack, I like using the ones that have the little beans in them. You can just throw it in the microwave and heat it up, and then you just like put it on your face. For relieving any type of neck pain that you're having, whether it's, you know, you have cervical dystonia or you have TMD and you have pain in your neck from the TMD, or you're experiencing any type of jaw or neck pain, really highly suggest getting a neck traction device. It comes with a little pump, and you just put it around your neck. They come in different sizes, so some of them will just be like one layered one like this one, some of them will have like 2 layers, some will have 3. What it does is it takes the pressure off the neck so that the spine has time to rest, and not only rest but release itself, but you have to use it over a long period of time. And again, anything that you're implementing, it's going to take time to get used to it or to see certain things improve. But again, it's like one of those things, you just have to try it, and then if you try it, you have to commit to it and do it you know, consistently, and then really consider if it's helping you or not. It relieved a lot of the pain in my neck and allowed me to overcome any type of issues that's happening surrounding my upper body. Jaw exercises, myofascial release, TENS unit. I'd rather say use castor oil or oil pulling over TENS unit if you can. TENS unit I really like, but if I had found the castor oil pulling sooner, I would have done that like immediately. And then if you are having TMD symptoms, sleeping on your side is supposed to help, they said. But if it's really bad, they said, you know, sleep on your back if you're having any type of upper body problems in your spine. When it comes to food, oh my goodness, I cannot say enough here about changing your diet. And I know that it's gonna sound like I'm like advertising like you know, veganism or that type of thing, but it's more so that I'm just trying to point out the importance of like thinking about what you ingest and how it affects your overall body, how it affects your tissues, how it affects the way your tissues grow, how it affects your cells and everything to a microscopic level. With TMD, you want to eat more soft foods, and you want to drink like hot teas. You want to make sure you're hydrated, avoid caffeine or alcohol. But I also highly suggest taking care of your gut health. Really taking care of your gut health. I mean, I can't say enough how there's been so much research on the importance of gut health and how probiotics help, fiber helps, and usually when it comes to this, balancing out your fiber intake and your protein and versus like how much fat intake you get and how much carbohydrates you get, it's literally like an art. And so when you're doing this, you literally have to change your lifestyle completely. But maybe you might think that it's overdoing it when it comes to TMD. You're like, why should I have to change my eating habits and complete lifestyle just for TMD? But I'm saying this is like a life change in general that I feel like would benefit everybody for their health, their overall health, not just injuries, but their health. Because if you think about it too, whenever you're experiencing injury, they always say that your recovery time is also boosted, it's improved by what you eat too. Some people try using like facial creams that help with the pain relief, like Tiger Balm or Arnica. You can try those. I've tried Arnica and that didn't really help me very much. Didn't really make a difference. Again, I always talk about good oral care. You can invest in a dental kit too, making sure that you're taking really good care of the muscles of your face as well by constantly massaging and doing facial stretches too. Psychologically, being aware of any triggers or stressors that you have that kind of inflict, if you have bruxism, like any of the clenching, or try to scientifically observe and notate when you have these flare-ups happening, like what time of the day is it, you know, when you eat certain foods, is it when you're stressed out about certain things, like really trying to pay attention of when it starts to happen and when it happens or how long it happens after you do something. Really thinking about your posture and your spine. A lot of this advice is very similar to what I use to help me overcome focal dystonia, but I have lumbar support, a back support thing. It helps me take better care of my spine and to address any pain in my back as well. Alright, so when it comes to jaw stretches, most places will always recommend chin-ups, tongue-ups, forward jaw movement, and resisted closing. Those 4 things are really important when it comes to mobility of the jaw, flexibility of the jaw, and addressing jaw movement. So I'm gonna go over a couple of the exercises here, which is gonna be a little bit embarrassing for me, to be honest. Some of them I might cover my face, but I will put a link in the description box to these exercises. And I'm using the 9 exercises from the American Academy of Family Physicians, the AAFP. So the first one is the relaxed jaw. You're gonna rest your tongue gently on the top of the roof of your mouth, behind your upper front teeth, and allow your teeth to come apart while relaxing. So I'm gonna go ahead and try and do this. I hope you're all trying this with me. Oh my goodness, I hope you're all trying this with me. Not all of them are difficult, but it just depends on the severity of your symptoms, and also it requires doing all of them. It requires doing all of them over a period of time consistently for them to be effective. The second and third exercise is called the goldfish exercise. The first one is a partial opening and the second one is a full opening of the mouth. So you're gonna put one finger on the jaw joint, and your jaw joint is right in front of your ear. So you feel in your front of your ear here, and also take your thumb and pull back to the back of your jaw here. You feel where your mouth is opening, and kind of pinch between the two fingers. And you can feel where your jaw joint is there. This is where your jaw joint is. So you can put your thumb there, and you place the tongue on the roof of the mouth and drop your jaw. And you push against the resistance of your thumb on your chin. So tongue on the roof of your mouth and push against the resistance of the thumb. And if you need to find where the jaw joint is, if you're like, it's not quite the right spot, then just feel around for it. Sometimes if you open it a little bit, like, you can see where it is. You can see where the jaw joint is. Sorry. I don't want to show this one on camera. Tongue on the roof of the mouth. Just remember that with that one. And start off by doing it with a partial opening, so not dropping your jaw too much, and then eventually working your way into a full opening. And then chin tucks. This is where you put your shoulders back, your chest out, and you create a double chin. You hold this double chin for 3 seconds, and you repeat this 10 times. So I'm not gonna show this one. I'm gonna cover it up, but I'm gonna try. Well, I'll try to do it, but I'm gonna cover it up, okay, you guys? Because that's just like, that's not fair. That's not fair that I have to show this on camera. So hopefully you're doing it with me. So you're gonna put your shoulders back, your chest out, and you tuck your chin in, and you're gonna hold that for 3 seconds. 1, 2, 3, and then release. And then do that 10 times, okay? One of the things that I like to do too is, like, I like to practice moving my head back and forth like that, because then I can kind of assess like how restricted my movement is. The 5th exercise is resisted opening of the mouth. So you're gonna put your thumb under your chin, open your mouth slowly, and push against it, and hold for 3 to 6 seconds. So put your thumb under your chin here, and try to open your mouth and fight against the resistance of the thumb. And again, you're not like, you're gonna make it like too difficult. You want to feel some resistance, but you don't want it to hurt too much. So number 6, you're gonna squeeze your chin, and you're gonna resist closing your mouth. Yeah, I can even feel it in my neck. Like, you can even feel the movement in your neck too, all the way back there if you're really aware. Number 7 is tongue up. You're gonna put the tongue on the roof of your mouth, not behind the front of your teeth, but on the roof of your mouth, because the first one you put it behind the front of your teeth. Now it's just on the roof of your mouth, and you're just gonna slowly open and close your mouth. Then number 8, you're gonna do side to side movement. So you're gonna put an object in your mouth in between your front teeth. You want it to be only about 1/4, like maybe the size of like a tongue depressor, and put it between your front teeth. And you're gonna slowly move your jaw side to side. So again, you're kind of testing for this range of motion. Then you want to increase the size of the object in increments, just to help with the opening as you're moving it side to side. Then last but not least is number 9, and that's gonna be forward jaw movement. You're gonna do the same thing. You're gonna put that tongue depressor between the front of your teeth. That's about 1/4. And you're gonna move your jaw forward, and you wanna move it in front of your front teeth. And you're gonna practice moving it forward, and then back, and then forward, and then back. I think some of the exercises people will ask you to hold it there, to hold your jaw in front of your teeth for a little bit and then release it. I'm not sure, you'll have to look it up, but I usually just move it back and forth. But you can do a combination of different exercises. There's all kinds of different jaw exercises out there for TMD that you can try. There's a lot of people that write about it, but those 9 are the primary ones that kind of address those important points of movement, which is the chin tuck, the tongue up, the forward jaw movement, and the resisted closing. Can't emphasize the jaw exercises enough, or facial exercises enough. Any type of facial muscle exercises you can find, or any type of jaw exercises you can find that you feel are beneficial to you, I cannot emphasize enough. Dental research shows that jaw exercises increase your mouth opening range more than using a guard, especially with people who have TMJ disc displacement. So just the fact that jaw exercises improve our range of motion says a lot. So I think, you know, as musicians, it's really important to even include these when we don't have TMD, even when we don't have something wrong with us. I think it's important to keep practicing, testing our range of motion. And if we have any type of restrictions with our jaw movement or any type of pain going on when we're moving our jaw, to really start exercising those movements, and also implementing things like the supplements and our being aware of our diet, taking good oral care, making sure that we're getting checked out, also doing our research as well. Before I go, I also want to talk a little bit about one last thing. So I did have somebody reach out not too long ago that was saying that they had tingly lips and their face was going numb. And I just want to say, for anybody that's experiencing that, it could be due to a lot of things. It could be due to a diabetes, infection, virus, food allergies. It could be drug related. It could be Lyme disease. It could be blocked lymph nodes or saliva glands. It could be allergic reaction to aloe or your medication, like medication related. So there's a lot of things go into play, and that's what's really important to figure out what the pathophysiology is and where whatever you're experiencing is deriving from. Because whenever you're experiencing anything in the face, whether it's pain or nerve damage or tingling or numbness or any type of symptoms in the face or upper body, and you're a musician, you really want to make sure that you're seeing the right person. Make a list of resources for yourself and keep it close at hand. If you're a teacher, make a list of resources for your students and also for people you can refer them to or to contact, or that their primary care physician can refer them to if they need to. That's all I have to say about TMD. Again, it's a very complex disorder. It's very hard to diagnose the culprit of what is causing it. If anybody else out there has any information on this that they'd like to share, please put it in the comments. If you have any experience with it especially, please put it in the comments. We'd love to hear about it and know more about your experience with TMD, and if there's anything that you've used that has helped you, whether it's a traditional medication or an alternative type of medication or form of treatment, please let us know, and if you have any references as well. All right, thank you guys. I hope you enjoyed this video. Bye.